a room, a registered play therapist, toys, and your child. Have you ever been curious about what actually happens during a play therapy session? Stay tuned to find out. Hi there, and welcome to my channel. I'm Kim Feeney. I'm a licensed independent social worker and a registered play therapist supervisor. I've spent the last 10 years helping children and families lead healthier emotional lives. Consider subscribing and hit the bell for weekly notifications because I'd love to help out your family as well. As we continue along in our play therapy journey with you and your child, it's now time for your child's first session with the play therapist. Every play therapist in practice is going to be unique. But today, I will discuss some things I like to do with children during their first play therapy session. If you are interested in finding out more parents' experiences with play therapy and also looking for a supportive community, consider joining our Facebook group for calm, empathetic, supportive parents and caregivers. The link is below in the description. Unlike most places children play, I do not start the relationship in play therapy by stating the limits of the playroom. Most play therapists believe a limit is not stated until it is necessary, meaning until a rule is broken or about to be broken, the limits are not stated verbally. Instead, the first thing I do is invite the child to play by welcoming them to the special playroom and explaining that sometimes in here I will get to be the boss and other times they will get to be the boss. This starts the relationship on a level of shared power. I also let the child know that in the special playroom, they can say anything they want to say and do almost anything they want to do. Usually then this leads into a conversation about confidentiality. And to make it developmentally appropriate for the kid, I'll use the word secret or top secret. And I'll explain to them that the rules are that I have to keep everything that's said here secret unless somebody is not safe. So again, that goes into if they're hurting themselves, if somebody is hurting them, or they're hurting somebody else, then I have to tell. And then I also share with them that they can tell the secrets to anybody they want to. It's up to them, and they get to choose who they tell what happened in the special playroom and who they don't tell. As a play therapist, toys are obviously an important part of my job. However, toys in play therapy are selected for specific purposes rather than just collected. There are toys representing real life, as well as themes of nurturing and relationships. Examples of these are going to be dollhouses, toy kitchens, doctor kits, and baby dolls. Some toys are used more for aggressive play, including soldiers, scary puppets like snakes and sharks, handcuffs, and swords. There are also going to be toys for creative expression, like art supplies, dress up, and musical instruments. Some play therapists also include mastery items in their playroom, such as books and board games. This wide range of toys allows the child multiple choices when choosing how to express themselves and their feelings. Comment below and let me know what category of toys you would be drawn to play with the most. As the play therapist in the session, I observe the child's play and make observational statements. Tracking is a form of play-by-play of what the child is engaging in. For example, in the dollhouse, I might say, that person is going into that room. We use generic terms like this and that, try to refrain from putting labels on things and allow the child to use their own expressions and labels. For example, a doll that traditionally looks like a girl, the child could label as a boy or vice versa. It really doesn't matter what labels the child puts on it as long as they're their own expression of how they're feeling. A play therapist also reflects feelings to the child. When a child first enters the playroom and appears anxious and is looking around, I will say to the child, "You are nervous and unsure what to play with first." Again, these are statements, not questions. The purpose of these statements is to communicate to the child that they are seen, heard, and validated, and that the therapist is present with them in the moment and will continue to be there and to be present as they explore the emotions and the challenges that they want to overcome in the future. Again, questions are limited in play therapy. Instead, the play therapist will make guesses as to the purpose of a child's behavior using statements such as, "I wonder," "I'm curious if," or "I think that." The child is then free and absolutely will correct me if I'm wrong. If the child invites me to play with them, I will join in the play. I have found some children prefer to have a play companion, while others enjoy playing on their own. It's really a case-by-case basis, and Some children feel different one session than they do the next. The most important thing to start building in this first session is to establish that relationship of trust and an environment of safety. The therapeutic relationship established allows the child to explore themselves and their experiences so that they can create change in the future. Don't forget to join our Facebook group of calm, empathetic, supportive parents and caregivers using the link in the description. If you found this video helpful, subscribe, give it a like, and share with a friend. On the screen are some other videos that you also may enjoy watching. Thanks a lot for watching, and wherever you are in your day, hug your child and make it a great one.